You describe yourself as a health tech futurist. So, what does that mean?
The description means actively that I'm actively participating in shape what healthcare will look like, not in 20 years, next 20 years, but also starts today. I think we need to improve the healthcare systems from today, from now. The future starts now. We cannot have a better future if we didn't start. We didn't try to transform. It's about asking bold question, challenging outdated system that we are working with in healthcare. It's about building bridges between medicine, technology, and human empathy. I think the technology is really evolving, but the healthcare system is not taking profit from innovation as it should be done. It means for the health tech futurists, it means imagining a world where precision medicine, artificial intelligence, and connected devices are not futuristic dreams, but daily tools to improve lives. It's about seeing the future not as something that we wait for, but something that we co-create because the futures, as I said, starts now. This is the idea of health tech futurists. The future starts now and we need to start now, directly now.
So, what is it that we need to change right now, today onwards? What is it about medicine or healthcare that we need to change now?
I think what needs to change now, we start by ourselves, me as physician and healthcare professional overall. I think we need to see the healthcare differently. We need to understand that we are not only clinician, we are educator, we are human. We need to understand that technology is evolving and the patient needs better healthcare and accessible healthcare. And we cannot have this accessible healthcare without technology. Unfortunately, you cannot assess your patient in remote area without using your phone. Well, you cannot access your patient without glucose glucometer. It's evident. We can patient sometimes is patient monitoring is a huge tool that we are seeing and it's changed the life of a lot of people. If it becomes more available, it will be more accessible and it will be much cheaper for the people that can, so everyone can afford it. And I think the main message that we need to understand is that doctors, physicians need to understand that their role for the healthcare system they are the cornerstone of healthcare system. If they cannot change, they can be left behind, and the main loser is the patient because
Why?
because sorry, go ahead.
Sorry, go on. No, my question is why do you think doctors are not ready for that change?
No, I'm not saying that the doctors are not for this change. I'm saying that a lot of doctors they are still thinking that they have the role of clinician and that's it. And there is a lot of doctors that are innovative and they understand that the health tech, mainly the young generation, they understand that the health tech and the innovation is the future of healthcare. But I'm talking about part of a healthcare professional, not only physician, that they are still doing their clinical or their healthcare duty without any evolution, without understanding that the healthcare system and the healthcare is changing. The healthcare now, it has started to change and it's evident that it's changing. And when you check, for example, can you imagine that we have glucose, for example, 10 years or 20 years ago, you cannot imagine that we can monitor the glucose for 24 hours for a patient. They cannot imagine that we can have an alarm for hypoglycemia for your father or your mother. You are living in the neighborhood. You can have an alarm for your father who has hypoglycemia at 50. You cannot not imagine this. You cannot, for example, imagine that there is a watch, smartwatch that's signaling that you have fibrillation. You cannot imagine this. And now we need not only to imagine the future, but to create it. And I think the main loser, if the doctors and the physician and healthcare and other healthcare professionals are not involved in healthcare innovation, is the healthcare itself. The healthcare itself cannot be improved without us, without healthcare professionals.
How do you think doctors should get involved in this?
I think it's easy. First, we need to be convinced about the transformation of healthcare by technology. And it's evident. Can you imagine that we century before we are not using stethoscopes? Do you imagine that we hear we do auscultation by our own ears and it was created a stethoscope? Can you imagine that now we can use like something device like a stethoscope that to do ultrasound. You can do directly like smaller device like a stethoscope that can, you don't need to listen to the heart. You can see it by ultrasound directly by a small device that link it to your smartphone. If you and we I think it starts by the conviction of the need of urgent and imminent healthcare transformation. And it means if you understand, if the physician understand this, he will need to update his knowledge, update his expertise in the new technologies, even if he doesn't he doesn't want to be involved. The healthcare system needs him because, for example, I'm a founder of a startup, and I'm an engineer. I'm biomedical engineer. I understand some part of the healthcare system, but I cannot see the real field of healthcare, and they cannot see the perspective of the physician. And also, I need the perspective and the vision of the patient. It's different. It's totally different. There is a point of view and the point of vision totally different. We need doctors, and we need that the mindset of doctor change. We are not only clinician, and we are not only carer and curer. We are also agent for healthcare transformation for the benefit of the healthcare system and for the benefit of patients.
Mark your calendar for Disruptive Doctors annual conference and exhibition. It's happening the 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025.
Join Disruptive Doctors. Oh, Disruptive Doctors. Impact.